Your healthcare provider has recommended a Sonohysterosalpingogram. This test may be recommended for reasons such as difficulty getting pregnant, repeated miscarriages, missed periods, or heavy period flow. A sonohysterosalpingogram, or Sono HSG, is a vaginal ultrasound exam that can show whether one or both fallopian tubes are blocked, which can prevent the sperm and egg from joining, or something is wrong with your uterus, such as a fibroid, scar tissue, or abnormal shape. Some of the risks of the Sono HSG include uterine cramps and pelvic pain, abdominal pain, and pelvic infection. If the fallopian tubes are blocked, discomfort may last longer, and the risk of pelvic infection is higher. If you have a history of pelvic infection, risk of infection after this procedure is sometimes higher. Preparation for this procedure is simple. You can follow your normal diet and meal times. If you have a history of pelvic infections, your healthcare provider may prescribe an antibiotic for you to take before and after the exam. If you are prescribed an antibiotic, take the first dose the day before the test. Then take the antibiotic for the next 4 days until all the pills are used up. During and after the exam, it is common to experience mild cramps and pain. If you think the cramping will prevent you from driving, please arrange for someone to take you home. 1 hour before your test, we suggest taking 600 milligrams of ibuprofen with food or milk. This will help ease mild cramps and pain. The best time to have the Sono HSG exam is between 5 days and 10 days of your monthly cycle after heavy flow has stopped. The exam will be performed in the fertility center. Just like a pap smear, you will lie on your back and your healthcare provider will insert a speculum and cleanse the cervix. A small tube is passed through your cervix. You'll probably notice some cramping. After the tube passes through the cervix, your healthcare provider will inflate a small balloon and inject sterile saline through the tube. Again, you may feel some cramping. As saline flows through the uterus and tubes, the healthcare provider will be watching the procedure on ultrasound. If your tubes are not blocked, the solution will spill into your abdomen. If you feel dizzy after the test or still have strong cramps, you can rest before leaving the clinic. Discomfort may last longer if your tubes are blocked. If mild pain or cramping continues a few hours after the exam, take ibuprofen or acetaminophen for relief. Call your healthcare provider if pain gets worse, lasts all night, or is not relieved with ibuprofen or acetaminophen. You should also call your healthcare provider if you have a fever of 100.5 degrees or higher. After the test, you can return to your usual daily activities and diet. However, wait at least 48 hours before you have vaginal sex or insert a tampon. We also advise that you do not use a douche. Call your healthcare provider if you have spotting or light bleeding lasting more than a few days, bleeding the same or more than a normal period flow, or discharge with a foul odor. Alternatives to a Sono HSG include fluoroscopic HSG, a similar test that uses X-ray instead of ultrasound, hysteroscopy, surgery to look inside the uterus, along with laparoscopy, surgery to look inside the abdomen with dye injected into the uterus and tubes. If you have any questions about this procedure or alternatives, your healthcare provider is the best resource to answer your questions.